and welcome to this screening of Unconditional Care, part of the All in Chicago 2020 virtual event series, and co-presented today by American Muslim health professionals. My name is Laura Cerisi Starr, and I am the Director of Development and Communications at CommunityHealth. CommunityHealth is the largest volunteer-based free health center in the United States. We provide primary and specialty care, prescription medications, mental health and dental services, health education, and lab testing, including COVID testing, on the west side of Chicago. Our patients have no health insurance, and we provide all of our services to them at no charge. We do this with the support of over 1,000 volunteers, partnerships with dozens of institutions, and donations from generous people like you. Thank you for being here and for supporting Community Health. I would especially like to recognize our many sponsors who are supporting this year's All In series, including Baxter, Blue Cross and Blue Shield of Illinois, AbbVie, Lundbeck, the Joseph and Bessie Feinberg Foundation, West Monroe Partners, and many others. I encourage you to visit our website, allin-chicago.org, to see the complete list of sponsors, read the bios for our incredible speakers, and check out the rest of the month's events. Finally, I want to recognize this year's All In Executive Leadership Council. We have the privilege of having 4 outstanding leaders serving on the council this year. Their great insights and support have been instrumental in bringing this year's series to life. Thank you to Joe Flanagan, Kimberly Hobson, Stacy Lindau, and John Maples for your contributions this year. And now I would like to introduce you to one of these Executive Leadership Council members, John Maples. John is the President and CEO of Delta Dental of Illinois. Thank you for being here, John.
Thanks, Laura. I'm proud to be here today and to be part of the All In Chicago 2020 series. The goal of the All In Chicago series is to bring together leaders from many different industries and segments of our population to talk about how we can all work together to ensure every resident has access to the right care in the right place and at the right time. While we're doing things a little bit differently with the virtual broadcast this year, Community Health has been hosting these critical conversations around access to health care since 2015. This year, as we're in a global pandemic, the conversation around access feels even more relevant than ever. Delta Dental of Illinois, my company, is a proud sponsor and supporter of the All in Chicago series because we recognize the critical connection between oral health and overall health of an individual. We're proud to support a wide range of programs and organizations that promote oral health education and ensure that quality dental care is available to all. Because we work so closely with many health centers here in Illinois providing essential medical home services, I'm really looking forward to this documentary and to learning about the Muslim American Social Services Clinic in Florida, featured in tonight's program. 2 quick housekeeping items before we get started. We're going to be live streaming this documentary on this Zoom platform to be followed by a panel discussion with a filmmaker, a patient, and other experts to discuss. We recognize that streaming through Zoom works better on some devices than others, so if you're having any issues, we'll drop a private link into the chat box where during this session only, you can go to watch the film on Vimeo and then return to the platform for the Q&A session when you have finished. While we recognize that switching back and forth is not ideal, we've made this backup option available just in case to ensure everyone has the best possible viewing experience. I believe Nina is going to drop that link in the chat box now while I'm talking. And then the second thing, you can submit questions at any time during or after the film using the Q&A button at the bottom of your screen in the Zoom webinar. We're going to do our best to answer as many questions as possible in the discussion. I'm personally really looking forward to learning more about the Muslim American Social Services Clinic in Florida. So with no further ado, please allow me to introduce tonight's film, Unconditional Care.
Hey. Hello, everyone. My name is Arshia Wajid, and I'm at Rush University Medical Center located in Chicago. I'm also the founder, and I sit on the board of directors for a national nonprofit organization called American Muslim Health Professionals, or AMP, which is focused on professional development, mental health, and advocacy for underserved communities. It is through AMP that I actually found out about Mass Clinic and this film. And after seeing this film again, I'm really looking forward to our discussion this evening. As we head into the panel discussion, I will ask our panelists to turn on their videos and their camera so you can see who is speaking during the conversations. And just a reminder, this conversation is happening live, so please be sure to submit your questions for our panelists. We will be sure to answer as many questions as possible during the 40 minutes or so that we have. And you can submit the questions using the Q&A button at the bottom of your screen. And now it is my pleasure to introduce our spectacular panelists for tonight's discussion. I'll start off with Munazzah Baghdadi. Munazzah is a community health program manager at the Muslim American Social Service Mass Clinic in Jacksonville, Florida, the one that was featured in our story tonight. She works to garner better communication and increase the clinic's impact between various nonprofit organizations in the Jacksonville community. Roderick Borisade is a professional speaker, poet, and storyteller, and a patient at Mass. His speeches have landed him on 2 TEDx stages, and he's currently working towards a master's degree at the University of Alabama. Matt Colaciello, our filmmaker, is now a media activist and TV producer. He is the creative director of the Laura Flanders Show, an award-winning nationally syndicated TV and radio program that reports on the people and movements driving systemic change. Nabil Khan is a researcher on American Muslim community-based health organizations and also works at the genomics-focused Broad Institute of MIT and Harvard in Cambridge, Massachusetts. He grew up in the United Arab Emirates, currently splits his time between Illinois, Pennsylvania, and Massachusetts, and has worked on public health and clinical research at Harvard, Columbia, and Boston University. So with that, we're going to start off with a few questions. And one of the questions that I had, came in is for Munazzah. Munazzah, you do a lot of work connecting the Mass Clinic with the community. When you're telling someone about the clinic, how do you explain what's special about this clinic?
So as you saw in the documentary, it's really reflective of what Mass actually is. It's a diverse group of patients, volunteers, and board members from different backgrounds and different cultures. And we go out of our way in many facets to just helping our patients, like the uninsured and the unemployed, in getting medical care benefits as well as some social care. It's unfortunate that they're in that situation, and we just want to, go out of their way to help them make their lives just a little bit easier. Whether it's just getting primary care appointments, specialist appointments, free or cheap medication, especially insulin. Insulin is such an expensive medication to get, and when you're in those situations, as one of the patients had mentioned in the documentary, they kind of have to be creative, unfortunately, in the way that they can purchase their medications. But we at Mass try really hard to get them on patient prescription programs so that they can get free or cheaper medications to help them just a little bit. So yeah, I mean, I've had patients come in and just cry because they don't believe that they're getting everything that they're getting at Mass for free, because they've lived their entire life without insurance, not being able to go get, healthcare benefits, and just waking up every morning thinking like today might be the day that I die. And I once had a patient just break down as I was just explaining to him what we would be providing for him going forward. But yeah.
Got it. Thank you. And Roderick, how did you come to learn of Mass Clinic?
So when I got sick, I spoke to my mom, and she had a coworker. She's a nurse, and her coworker informed me of Mass Clinic. Her coworker is my auntie Banky, and she volunteered at Mass Clinic. And I told her of my situation, and she was the first person to let me know of this place that I've passed by 1,000 times that I didn't know what it meant or what it was, but she introduced me to it.
Nabil, you and your colleague, Dr. Lance Laird from Boston University, produced a report on impact of Muslim-free clinics. What led you both to study Muslim-based health organizations specifically? And how many other clinics like the one in the documentary are there?
So the question of what led us to focus on Muslim community-based health organizations, I'll give sort of like a broad answer at first, and then I'll sort of dive in or move in a little bit more granular. I think so. Dr. Laird, who you mentioned is my co-author on this report, is not a Muslim, and but he has a long history with Muslims, like a good history, and I think something that he and I both also had studied religion in the past, and we're both interested in how religion how religion shows up or is a presence in healthcare spaces and in medicine, and then vice versa, how taking care of people and ensuring their well-being is part of religious communities. Specifically, we were interested in Muslim community-based healthcare organizations because we knew that there is a long history of Jewish and Christian health-based organizations in the US, going back at least a century. And the Muslim community is, it's not, I mean, there's been Muslims in the US since for hundreds of years, but I think sort of it's grown at a critical mass more recently in this last century or so. And we've seen that as the Muslim community has sort of solidified, you see these sort of outgrowths, these ways of being involved in the American landscape that include, many different things, from the arts to politics, but also sort of setting up these kinds of organizations to sort of give back and strengthen our communities. And so we thought, it'd be really interesting to explore this topic further. And as to how many clinics there are, we were able to confirm that there are about 70 in 2018 when we did most of the research for our study. But it's important to note that the numbers have actually continued to increase. We don't have an exact number to date, but it's probably closer to 100 now, just a couple of years later. And it's also important to note that these organizations are part of a larger phenomenon as well of free clinics and community healthcare centers throughout the country, but especially free clinics. There's about 1,400 of them across the country. So, that's a lot of services and a lot of money and time that is mostly being provided by volunteers to sort of make up for the healthcare gaps that so many in our society face.
Question for Matt. Matt, what inspired you and your colleague Jake to make this film? You're on mute, Matt. You're on mute.
Okay, no, I'm not on mute. Thank you to Community Health, first of all, for screening the film and for holding this event and bringing us all together. Well, I guess the simplest version of why we made this film was I don't like hate, and I do really like compassion and empathy, and really look up to people who notice things in their community, that, you know, the holes, the people being left behind, and try and work to fix that. So it was sort of having Muslim friends tell me about this clinic and learning about it, and then also seeing for years now this rising Islamophobia in the United States that is completely unjustified. So that's sort of the basic thing that you kind of wanted. I'm sure if you were a patient at Mass like Roderick was, you want to tell people about it when you find out about it, because it's such an incredible example of human beings serving other human beings pretty selflessly. And then on top of that, in the political context that we're in, it's a vital story for people to know about, because it's a representation of what Muslims in America are doing, and an example of what people inspired by their faith can do for their community. And then I've got my, I don't want to speak for too long, but the other thing that happened that I guess was an intersection of this in my own life is that a former student of mine who had become a friend, his life was taken by a white supremacist when he stood up to protect two young women, one of whom was wearing a hijab and presumably Muslim, being harassed. And so my co-filmmaker and I came together to make this film. He was also a friend of the young man who was murdered, Talijan Namkai, who we thank at the end of the film. So we came together and decided we want to make this film along with another friend of ours from Jacksonville. And we sort of began that process.
Thank you. So there's a question that came in from the chat. How are you able to sustain your free services? Is it government grants, charitable contributions?
So I believe that would be a question for me. I am actually the grant writer for the Mass Clinic. This is my second year writing grants for them. And we have completed both government grants as well as private grants from hospitals and charitable donations. We have a link to donate at our clinic on our website, massclinic.org. And then every summer, I spend the summer writing grants so that we can get more funding for the clinic. So yeah.
Okay. And then a question that's also come up is, why do you all feel that free health clinics is necessary in Jacksonville and throughout the country? So I'll actually, all of you, if you can address that a little bit, and maybe we can start off with Roderick.
I think they're very necessary. I feel like there's a huge gap in healthcare for people who can't afford healthcare. I feel like if nothing's done about it, then you're essentially saying that these people don't deserve to live, and that's inhumane to me.
I mean, so many millions of Americans because of COVID have now become uninsured that weren't before, because we tie insurance to employment. And again, as Diane is saying at the beginning of the film, we treat healthcare as a privilege, not as a universal basic need or a right. And so we're living in the manifestation of that. I mean, in 2018, we certainly were, and Diane outlines the problem, and then you see, wow, there are so many people coming to this clinic. And also during COVID, I mean, I just kept thinking, wow, I'm actually really interested in seeing how Mass is addressing that gap right now, because I actually don't have the full update about what they're doing. As you look at that footage, one of the things that happened in my mind was I was thinking, oh my God, all those people so close together with no masks, So I guess, Arshia, is it okay if I ask Munazzah a question about how they're dealing with COVID and the inability to have everyone come to the clinic?
Yes, please. Mm-hmm.
So in 2019, We had started to implement telehealth for specific programs that we've had addressing chronic care issues. So for our patients that had hypertension and diabetes, we wanted them to have a telehealth feature so that they didn't have to come to the clinic in order to just refill their medication. Unfortunately, at the time, it was very difficult to get people to follow that program. Unfortunately, due to the circumstances that we kind of were forced to be in, and kind of we've entered the Zoom world kind of, we implemented an in-house developed telehealth program, which allows for a secure location for the patient to speak with the patient care coordinator, as well as medical assistant and the medical provider or physician, and take care of whatever needs that they need and get their medication refills. Now that restrictions have opened up a little, we do have a mix of, I guess, telehealth appointments as well as in-clinic appointments, but we leave that for the specialty care that you need to come in for, like orthopedics and things like that. But primary care is still on telemedicine, so thank goodness to tech, where we were able to still provide medical care for the uninsured, especially in the given circumstances. And our population has just increased since COVID has become a thing and people have lost their jobs, unfortunately, but we're busy.
I just wanted to point out something that we found in our research. I don't have the statistics for free clinics generally in the country, but for Muslim-run free clinics, the majority of them were found in the South or in the Midwest. There were very few in the Northeast. And I thought that was interesting because a lot of these states where a lot of the clinics are the ones that were slower to sort of expand Medicaid, for instance, when the Affordable Care Act happened. So you definitely see a correlation of where these services are most needed and where these clinics are. And I think one thing that I've heard, I've heard this comment made, from people with a certain political view that, oh, well, if there are gaps in healthcare but free clinics or community health centers like this are there to meet the gap. So what's the problem? And that, my response to that is, no, the work that's done by these organizations is tremendous and so important and amazing, but it still means that some people, certain groups of people may have to be, might be going to free clinics and relying on volunteers, while others can more easily go to any number of hospitals or clinics nearby. And so there's still that inequity that I think we need to address systemically, even if we do have clinics, who are doing such great work to fill in the gaps.
There's a question that came in from Nancy, who did not realize that Florida stopped Medicaid. And if maybe, Munazzah, this is you and Roderick, if you can speak a bit more about how that could happen in a state with so many elderly. And Matt, feel free to chime in. You're from Florida too, so if you have any insights on that. So the question is, can you speak more about how could Florida stop Medicaid and how that can happen in the state with so many elderly?
Well, Medicaid treats people who are not on Medicare, so people who are, I think, not on Medicare, as in not 65 or over. And it's not that Florida, it's not that Florida has stopped Medicaid, but rather that they did not take the option when the Affordable Care Act passed to expand Medicaid and make it available to more people. So that's what was referred to in the film.
And Roderick, having gone through a personal health crisis, what would your message be to elected officials from both sides of the parties, right, in regards to health policy and access to affordable health insurance? You're on mute, Roderick.
It muted by itself. Here we go. I would repeat that something needs to be done. There's a job to do. When I was in that clinic and I saw all those people just like me in the same situation, I knew that this is probably just a piece of what is going on all around the state, the country. And I just felt for people, and I couldn't imagine, I don't even understand how we're in a country that isn't taking care of its people, because everyone has a story and those stories are being abbreviated because they can't afford health insurance. And it doesn't make sense to me.
So another question that came in from Mohanad, how can people see this documentary? Will it be available on Netflix or other such device or other such services?
Yeah, the film will shortly be available on AMHP's website, and that's probably the easiest place to find it. We have the possibility of being available on Amazon Prime, but that hasn't happened yet. So for right now, in the near future, you'll be able to see it there and share it as widely as you like. And also, if you're interested in organizing a screening, we're happy to support you in doing that.
How would they contact you if in case they want screenings done? What would be the best way?
The best way, I think, would actually be to contact AMHP. And they can reach out to us. You can also email me directly. I can put my email in the should I do it as a Q&A answer? Yes, okay. And I can also, I'll put in the address for the page about this whole project, including the research that Nabil and Lance Laird have conducted on AMHP's website, AMP's website.
Nabil, can you speak a little bit about how the clinics in your report are similar and different than other community health centers?
Yeah, that's a good question. You might be wondering, for instance, I think when we are talking about these Muslim organizations, we'll refer to them in shorthand, as Muslim clinics. And you might be wondering what makes a clinic Muslim. And the short answer is that it's any sort of, I think for the purposes of our study, it was almost incidental, like being Muslim to the clinic's identity or to their work for the most part, though there are exceptions, but for the most part, most of these clinics was certainly founded by people who included Muslims. And a lot of them did have some sort of foundation in a mosque community, but a lot of them sort of become separate from the mosque and most of them, the vast majority of them are not just serving Muslims. And I think almost none of them are proselytizing. So it's, what does make them different from other community health centers? Well, I do want to say, for one, these are all free clinics, and community health centers and federally qualified health centers do get some funding from, they'll get private funding as well, but also some state and federal funding. And free clinics, generally all their care is free. While with some of the other community health centers, there might be some fee for service. So I will say, to close my answer, on the one hand, maybe there aren't that many things that are different from a lot of other clinics, but just because these clinics aren't, the focus of these clinics is not religion or religious identity, and and that's great, doesn't mean that religion isn't important, or that the fact that a lot of Muslims are immigrants or children of immigrants, or people of color or Black people. I think that probably does have an effect on dynamics and sort of relationships to the community, the underserved, underinsured community, a lot of whom are people of color. And I think just having that experience, Muslims themselves often being seen as outsiders, probably does have an impact on motivations as well as on interactions with the patients.
Can I also say, oh, Arshia, I think.
Go ahead, Matt.
Okay, I was just also going to say yes to everything Nabil said, but I wanted to add that in my experience of being at the clinic while we were filming over the course of 2 months, was that despite the fact that no one was proselytizing, there really wasn't any conversation about religion at all going on, there was something spiritual about being there. And it wasn't a spirituality defined by a religious identity necessarily, although I definitely, of course, associate it with Islam because of who is there. And but there was something so uplifting. I try to say this every time I'm on a panel discussion or every time I talk about this film. There was something so uplifting about being in that space with everyone working together so cohesively, and that everyone was gathered there not for profit, which is always the case in American spaces. We're always gathered in some way. We find ways to commoditize everything we do. And to be in that space where human beings were assembled, helping others in need, really was very uplifting to be there. And I think that patients who go there aren't just experiencing the benefits of being able to access healthcare, which is so vital, but also the kind of uplifting feeling of being helped and being cared for. So yeah, I just wanted to say that. And I hope it comes across in the film, but yeah.
I definitely think it certainly does. And thank you for sharing that insight. Roderick, one of the questions that has come in is, if you're comfortable speaking about, so we hear a little bit about your journey with the healthcare dilemma that you had, but are you comfortable sharing what happened afterwards? I mean, did you have to go through treatment? Did you have to also go to the hospital?
Yes, I'm fine with it. It turns out I have multiple sclerosis. I don't hide. I wrote a poem and put it on my YouTube channel to encourage other people, but that was the beginning stages, and it brought me back to my neurologist. And my neurologist was at Baptist, which is also somehow tied in. And I came back to Mass Clinic to see another neurologist who confirmed that I was at a good neurologist. And it's just been a family affair. Just like Matt said, when you're in there, there's an energy. I ended up donating some money to Mass Clinic once I got better and had an event and donated money because I care so much about that place and how much they did for me and how much they do for people. They're so necessary. But MS has not defined my life. Like you see, I'm at University of Alabama. Everything is so much better, but I attribute a good amount of that to Mass Clinic and the things that they did.
Munazzah, one of the questions that's come up is about dental care and if that's also being offered at the clinic and how that's being managed.
Currently, dental care isn't offered at Mass Clinic. We focus on primary care and a few specialty care. So we have cardio, endocrinology, orthopedics, neurology, PT. We do like eye screenings, a lot of other specialties, just not dental care just yet.
Okay. Question from Dr. Lance Laird. If you can speak to how the film portrays relationships between local Muslims and other faith communities, example, the Baptists in the film.
Right. So our volunteers, are the doctors and physicians that are volunteering their time, as well as the student volunteers. Majority of them are not Muslim. They're from other faiths. When you come in, there's, you're not only going to see Muslim people, there's a vast variety of different religions that are coming together to offer their help. So it's a very interactive space. There is like religious pamphlets around, but it's not, you know, the focus of the clinic is really just getting care for the patient.
Matt, the question for you is, how did the research and network building, your partnerships with Nabil and Lance and AMP, how did that become part of the film production?
Well, I and my co-filmmaker Jake and our executive producer Oscar Syed felt really strongly that the film needed to have an impact, that the making of the film needed to have an impact that went beyond just even sharing stories, but also trying to do something else for this movement. And that something else ended up becoming this partnership with Lance and Nabil, and then with AMP, because we just in the film initially wanted to contextualize mass. But when we started looking for an article, a study, anything, you know, we were just Googling, we found articles about the kind of movement, but nothing said this is how many clinics are, and certainly nothing quantified their impact. Like, here's how many thousands of people across the US are receiving free treatment from these kinds of clinics, or here's how many public dollars roughly are being saved by having these clinics. So because we couldn't find anything like that, we started reaching out to scholars who had done work about the clinics, and Lance Laird and Nabil ended up coming on board, and it's been incredible to work with them so that we could actually generate numbers around this. Lance had done a more qualitative study about a few clinics, and now we were able to do a more quantitative study about as many clinics as we could find. And right now, what's already in the works is an update to that work and the integration of some more qualitative research as well. So yeah, I'm really excited that it's happening.
And a question from Ryan. On the 2016 election campaign trail, there was an increase in Islamophobic rhetoric that went as far as calling for Muslims being banned from entering the US. How do you feel this type of rhetoric impact Islamic clinics such as the Mass Clinic? I think this is just general for anyone in the audience. Anyone want to take that?
I mean, I can just say that we're all aware of how that's affected, how it is affecting the way that it feels to live in our multiracial democracy, which feels like it's kind of on the brink of not feeling like a multiracial democracy. I am not Muslim, so I can't speak to personally the way that it's affected me, or personally the way it's affected the people who work at the clinic. But I know that, you know, conversations have been had at the clinic based on everything that was shared with me, with people who occasionally come in and did not realize they were going into a Muslim-run free clinic because it's called MASS. People didn't realize the acronym stood for something or what it stood for. And so, yeah, there have been people who have gone on journeys from feeling Islamophobic despite never having an experience with a Muslim person, to, you know, being like a completely different sort of advocate, like from not really knowing or having negative feelings to being an advocate and speaking to their own friends who might be Islamophobic, to say, no, you have no idea what Muslim Americans are doing. So we touched on that a little bit in the film, but everyone shared stories of having experienced that with patients, as in the staff. So yeah, I think that it's something that everyone is dealing with and working on, in part through the clinic.
And just to add to that, I also am not sure of the specific impact of President Trump's rhetoric in 2016 and since. And that is something that we are hoping to get at more perhaps in this revised or updated study that we are working on. But I think, at least since 9/11, if not before, there were a few clinics that had started in the 80s and 90s, but there was like a there was just like a much acceleration of the development of these clinics in the 2000s after 9/11. And I think, and maybe, even AMP might speak to this, but Muslims are an important part of healthcare generally in the US. I think I've read that about 5% of just American physicians are Muslims. And that's not even counting, nurses and allied health professionals and, and others and public health professionals. And I think it's been interesting. I think like I mentioned earlier, Muslims are kind of becoming louder and more visible in a lot of different arenas. But I think in healthcare, that's one of the main ways that Muslims have historically in the US tried to make their mark and sort of try to be representatives of the positives and the beauty of their faith and of their culture.
Yeah, I could say at Mass.
Go ahead.
Sorry about that, Arshia. We just continue to do what we were doing prior to Trump being elected at the clinic. Our mission is just to help people. It's part of our faith, and we kind of just continued on doing that, didn't let certain rhetorics kind of stop us from giving back to our community.
Sorry, I was just going to mention about, so AMP hasn't done research directly about the impact from health professionals, but there is a study that the Institute for Social Policy and Understanding, ISPU, they did a study for the state of Michigan. And if I remember correctly, I believe the number is 15% of all physicians, they happen to be there happen to be Muslims, and they were able to quantify the impact that they had on healthcare. So another question, moving on to the question, another question that came from the audience from Dawn. Are you screening for social determinants of health at the clinic, and how are you continuing to expand relationships with community-based organizations?
Is this for me?
Sorry. Mm-hmm.
Social determinant being like mental health care, or I'm sorry, I just.
Meaning how a patient's, oh, sorry, Nabil, that one's for you.
Oh, I was thinking maybe, I'm not sure if this is what the questioner meant, but maybe things like sort of, socioeconomic status, immigration status, things like that, and sort of their correlations to access.
Okay, sure.
Housing, food insecurity.
Okay. In terms of becoming a patient, all that we screen for is that they make below a certain percent of the federal income level. So they have to, I think, a month less than $2,000 per family, like per person in the family. So if there's two people, that number increases, and they can't have any insurance. We don't look at, their immigration status, just socioeconomic status and whether they have insurance or not.
Okay. And is there any perinatal health care services that are being offered at Mass Clinic? And any other services that are missing that you are still aiming to provide in the future?
Dental is one that we hope to get. And then we always want more specialty care doctors to volunteer their time. We do work with a local nonprofit clinic in Jacksonville who helps us get other specialty appointments that we don't have volunteers for. So we work with our community in order to provide full care for our patients. So if we don't have that specialty in our clinic, we refer them to another local nonprofit clinic in the city that would provide that appointment for them, again, free of charge. And this includes if they need like surgeries and MRIs and CT scans, all that is included. We work with local hospitals as well.
What else can healthcare providers do in addition to volunteering their time at the clinic to help the uninsured?
It's just time and money, honestly.
And, you know, I think, yeah, definitely. I mean, I volunteered at a clinic before. I'm not a physician, but, you know, they, and community health is another great example. And please, Laura and Nina, if you're still able to chime in, feel free to chime in on this question too. But there's definitely a lot of need that these free clinics have. So, you know, trying to link up, making connections with funders or with hospitals, or with foundations or organizations or medical device companies or equipment companies that can potentially donate their equipment for free and stuff. So there's definitely a huge need. And I think if it's time, talent, and treasure, these are the three things that, you know, free clinics, irrespective of what background they're in, that they would need from community members. Nabil, there was a question for you. How do these Muslim clinics fit into the story of healthcare in United States generally speaking, including charity care? And secondly, the US history of faith-based community organizations?
So I think to kind of address both of those points, I would say that I would just like to point out the important history of faith-based organizations in healthcare and social services, going back at least, I would say, especially over the last century or so. I think there was a big increase in this country in such organizations, and like starting in the late 1800s as urbanization became more of a thing, as the population of the country, you know, and with industrialization and the railways and everything, it became, there was just much more of a need for healthcare than could be met even back then. Hospitals were, you know, 100 years ago were few and far between, and a lot of healthcare used to happen at the very local level and at homes. And so as the model for healthcare began to change, there's always been a need to meet that gap. And faith-based organizations, for multiple reasons, have been very significant in meeting that gap. And you know, and for some of these organizations will start out providing care for their own communities, say, you know, for instance, Jewish groups facing discrimination will be like, well, we'll have a, you know, a community organization just for us. But eventually, if you're living, you know, in this country, and especially because of just how diverse most areas of this country are, you realize that you know, that care is really needed by a wide sector of, or across sectors, and across all kinds of groups in our society. And I know that there are also some controversies around, you know, certain practices in faith-based organizations generally sometimes, but I think going back to something that Matt had said, because these organizations can really tap into people's values, like their core values. And service and volunteering has always been such an important part of most religious traditions. I think faith-based organizations have a lot of social capital that I think should not be underestimated when it comes to healthcare generally in the US.
Roderick, this question is for you. Can you share a little bit about, in terms of access to affordable medication? Because the cost of medications, we haven't even touched that topic. This is just more access to health services. But there's another huge dilemma out there for individuals where the prices of medication is just outrageous, where people can't afford and they have to choose between getting insulin shots or between buying food. So can you speak a little bit to that?
For me, and my situation is my situation. Everyone is different, but my journey introduced me to neurologists, and the conversations we had led me to free medication for what I have. And it's out there for anybody who has anything that I have. I mean, y'all can email me or something. I can put you in touch with the people, but there's a chance that you can get the medication if you have the disease or the MS that I have. You have access to that. Any other medication, I wouldn't know how to get free medication. But I talk a lot, okay? I've been reserving myself this whole time, but I do talk a lot, and I spoke to my neurologist and we continued to talk, and I wrote a poem and they were impressed with that. And it led me to a program that offers free medication for what I have.
Arshia, I can actually speak
Mm-hmm.
a little bit on that. Many drug companies have a patient assistance program that if you qualify, and many of our patients that we see at Mass do qualify, can get free medication. So a lot of the insulins and the hypertension medications, our patients, we apply for them to get free medication. It gets sent to our clinic, and then they come pick it up every month. In Florida, we have a pharmacy associated with a grocery store called Publix, and Publix actually provides a lot of free medications, often that your hypertensive and diabetic patients would need. So your metformin and your blood pressure medications, they could get that free of charge as well. So you kind of just have to, I mean, we have the resources in Florida, and unless you qualify for these patient assistance programs, you can get it for free regardless of where you are in the US, as long as you're a resident. I'm not sure about local other local options that you might have, just Florida based.
Okay, great. Well, thank you for sharing that. So we are out of time, and I want to thank each one of the guests tonight for spending their Friday evening with us. I want to thank the audience for joining us as well, and most importantly to CommunityHealth, which is an amazing organization, and I hope every one of us supports them. They're doing phenomenal work, and thank you to them for inviting us and actually hosting this panel today. Now I'll invite Laura Starr back to wrap up tonight's program.
Thank you so much, Arshia, and thank you to all of the panelists for your great insights. This was truly a wonderful conversation, and I know there were so many questions from the audience. We all just really got so much from the film this evening, so thank you. As I mentioned earlier, today's program was brought to you by CommunityHealth. So all of your donations that you made when you signed up to join the program today will support CommunityHealth's mission to serve those without essential health care. And while we are not a Muslim-run free clinic, we are also a free clinic located in Chicago and operated by volunteers, very much like Mass. So please consider making a contribution now to support CommunityHealth if you have not done so already. Instructions are on your screen, and I will ask my colleague Nina to drop a link into the chat for you as well. On behalf of the staff, board of directors at Community Health, and the volunteers here, I want to thank all of you for being part of our All In Chicago series. I hope that you're all leaving today with ideas for how we can work together to make the vision of access to care for all Chicagoans a reality. We have 2 more events coming next week, and they are both free to attend. I encourage you to check out our website, allin-chicago.org, to learn more about the great events coming up and register to be all in. We all have a critical role to play in this effort, so thank you for being part of today's event.